I'm Dr. David Beaulieu, and I'm back with more news you can use. Today I'd like to chat with you briefly about new cholesterol recommendations. As you well know, we've spent years on a low cholesterol, low fat diet, both of which are wrong, taken endless prescriptions for cholesterol lowering drugs, and worried ourselves silly trying to get our bad cholesterol, our low density lipoproteins, or our LDL numbers down. And suddenly, it isn't all that important. Whoops, what happened here? New recommendations from the big three, the American College of Cardiology, the American Heart Association, and the National Heart, Lung, and Blood Institute have made their new recommendations, to the horror of most people in cardiology, actually. The recommendations? Quit lowering LDL to target numbers of 100 milligrams per deciliter or less. You're kidding me. This has been the benchmark for 25 years. Why all of a sudden is this panel of experts agreeing that there's no evidence to support LDL treatment to a specific target, in this case, 100? There's no evidence. They've looked at all the literature. The experts have looked at 25 years worth of literature and 180 degrees reversed their position. Is anybody out there paying any attention? Does anyone out there know what the heck they're doing? I'm not sure the answer is yes. It doesn't look like it. The main cause of heart disease and heart attacks isn't about low-density lipoprotein. We're talking about American diets that are toxic, loaded with nutritional deficiencies, loaded with toxic fat, loaded with toxic chemicals. It's not about cholesterol. Cholesterol is absolutely essential. It's why the body makes so much of it. It's a basic building block of a lot of your hormones. Anyone out there heard of the importance of vitamin D over the last 5-6 years? Everybody's talking about all of the wonderful things vitamin D does. The body makes it from cholesterol. Geez, I think it's amazing. There's no evidence to support LDL treatment to a specific, no evidence. Why have they been doing this for 25 years? I've been telling my patients for 40 years, cholesterol is not the problem. If your cholesterol's over 200, let's not get excited. If it gets over 250, let's raise an eyebrow. Let's make sure everything else is going the way it's supposed to. Why would the body push the cholesterol up that high? When the cholesterol gets too low, that's under 175, and that seems to be where cardiologists want to put your cholesterol. Guess what happens to your dementia risk? It goes through the roof. When are we going to get it right? I guess that's the question.